Okay, so I'm joined with the absolutely fabulous Andrew Hansford. And I've known Andrew for a very long time. We met while we were both working in Bermuda. And some many years later, I had arranged a reunion. And we all met at the Savoy Hotel. And in walks this fabulous Andrew Hansford, looking 20 years younger than the last time I saw him. And I was like, what have you been doing? And he told me that he's now in aesthetics. And I was like, oh, we need to talk. So we did. And then I did my very first needling course with you, the Derma Pen. I've since done advanced mesotherapy, again, all needling. And it's just opened up a whole world to me in the aesthetics business, because Andrew trusts people like us that aren't medics, but we are skin specialists and have a passion for skin and anti-aging. And he's really paved the way for us so we can go on and do these qualifications, you know, do the level 4s, so that we are able to do it on all of you lovely clients, because we obviously want the best for you and your skin. And as I bark on about all the time, needling, to me, is the most amazing thing ever. I love it. But I thought it's nice, rather than me keep harping on about it, to actually listen to somebody else, so you can get bored of me. I know, as much as I know you do love seeing me, but it's nice to listen to somebody else, isn't it? And explain how you got into doing this in the first place, Andrew.
Oh, thanks for that lovely introduction. Yes, we have known each other for a very, very long time. We should just have a story session rather than talk about aesthetics, because that could go on for a very long time.
I know, but that might be the after show, the triple X.
Yeah, after show. Exactly, with wine.
With wine.
Yeah, well, after I left Bermuda, I went to California and moved to San Francisco, and I started doing some modeling and stuff like that. It was all very dramatic and horrible, and I just hated the industry because it's fake and frivolous and people are lied to, all under this proviso of beauty. And I just thought I need to do something about this, because people were being manipulated by product houses, by fashion houses, by modeling agencies, by bookers, everybody, including myself. And you end up becoming incredibly insecure in an industry where people think that you are the most secure. Well, you're absolutely not, because you're absolutely, annihilated. So I came out of that and started studying medicine to understand the concept behind skin and health, and because obviously a lot of these models had acne, because a lot of them are very young. They were getting awful skin conditions because of the fact they never ate, or they were taking too many, whether it's prescription or other forms of drug intake to maintain weight loss or to maintain breast growth. I go on this one because I just hate it so much. So I had to learn all this stuff so I could actually not sound like, and I quote, the thick ex-hairdresser, which is what I was told on numerous occasions, to not listen to me by these big product houses. So in the end of the day, that's what happened. So I got all that education behind me, and then I moved back to the UK to put it into practice, to try and see if I could help. And that's really 20 years later, it's where I am now. So education is my passion. Yes, I do clinical work occasionally, but I realized that talking is my thing. Gobbing off, which is I'm very good at, and bringing the legislation into practice to give the beauty industry, which I'm obsessed with, the voice that they deserve, which they haven't had until quite recently, in actual fact, and losing the stupid stereotype that's out there. I mean, unfortunately, the stereotype is kind of coming back with certain people who are doing things they shouldn't be doing. But this country has the best beauty therapists, as far as I'm concerned, in the world.
And you've travelled all over.
And I know that.
I was going to say, you train all over, don't you? So
yeah. So I know that they've got it here. The level of education here is really high, and they need to be given that authority and that prestige and that ability for people to understand that. The good medics in this country work side by side with therapists, most of them. The bad ones, the arrogance, well, that's completely different. But the good ones really do, because they understand that skin therapists know more about skin than they do.
Yeah.
And that's not being negative towards medics, because they don't do skin in medical school.
No.
So, but therapists do. So that combination works beautifully. And it's, you know, I've now got a lovely network of therapists who I love, respect, trust, and we're, you know, flying the flag for the advanced therapists, because they do know their stuff.
Yeah, well, so I wouldn't mind doing like a little series really with you and interviewing you with different things, because it's such a plethora out there of different advanced treatments that we can do now. I mean, it's an exciting time to be in this profession, because it really is where, you know, science meets beauty, medics meets beauty, and it's amazing. So what I really wanted to talk to you about today, as I've said already, is the needling. And the first treatment that you trained me in is something called, well, it was a Dermapen, which is a brand name, but it can be any type of pen, microneedling system. And that is basically as big as it is. It's like a pen. We attach the device of the needles onto the head there, and then use it with different serums and so forth. So would you mind sort of explaining what the process the skin goes through, of why it is such an incredible treatment?
Okay. Pull me back if I go off on one, because you know I can. Well, in clinical application, or any clinical treatments, have to have a backstory. That's number one for me. So that means clinical evidence, it means white papers, it means trials. And when you get a lot of fad treatments, of which we know there are so many, the first thing I ask for is, can you give me the white papers? They look at me like I'm insane, because I don't know what they are. And then I walk away, because there's absolutely no point unless you've got clinical evidence to back up anything. They won't do it in medicine. Why should they do it in aesthetics? With medical needling, it has phenomenal evidence, because it doesn't come from beauty, it comes from medicine. It comes from a treatment called subcision, which has been around forever and ever and ever. And what it basically is a large hypodermic needle used for people with acne scarring, contracture scarring, and things like that. And what they will do is insert this hypodermic needle. Sorry if any of you are squeamish with needles, but the needle goes underneath the area of scar, and they wiggle it like this, which breaks the sinew that attaches to the lower portion of the tissue, and the scar tends to pops out over a period of time. It's not pleasant, of course, but it absolutely 100% works. And what happened is, over a period of time, the scarring would subside, but what was actually happening was the skin was becoming far better. It was thickening, the collagen was happening, it was doing all sorts of lovely, gorgeous things. And then they suddenly realized that, oh, wow, of course it's going to, because we're wounding the tissue. Wound that you create collagen, it's guilt by association. You cannot not do it, which is the reason why it works. So with fast forward, because obviously that's a very medical procedure and also a bit, they created a thing called the roller. So it's probably what all of you would have been first aware of when they first hit the marketplace, a thing called derma roller. Because we want to produce collagen, but we don't want to hurt the epidermis at all. That's the deal breaker here. So we don't want to cause trauma negatively on the surface, because that's going to be downtime, pain, all rather not very nice. So by maintaining the integrity of the epidermis, we could put very, very, very fine needles through the tissue to stimulate a very similar response to what would happen with a big hypodermic subcision protocol, without the drama of downtime. Obviously, rollers were the first thing, but no negative towards rollers, but they are uncomfortable. They can be quite painful, and downtime, there's a little less control with a roller than you have with a pen. And then a few years after them, the pen arrived, and that is a mechanical system with up to 12, 14 needles that go really, really fast. through the epidermis, almost pain-free, and it's a little bit more, and you can get more of a target.
Yeah.
And they were amazing when they came out. Everyone was like, wow, this is great. With trying to keep, if you keep it really, really simple, because it really is, we're not looking at the pen or the roller or the product or anything else. We're putting that aside. Brand is not important here.
No.
It's really about what the skin does pre and post any form of needling. So the simplest thing, and the way everyone understands it when I teach it, is if you cut yourself, if you scratch yourself, if you have surgery, all of those things create a wound healing cascade, which technically means the body, the brain is told it has been hurt and there is a hole somewhere that has to be filled.
Yeah.
And the first thing and the most important thing is to stop infection. Then the body goes into a wound crisis. So this is where we can absolutely 100% guarantee that this is the top of the tree when it comes to anti-aging, because if you hurt yourself in any form, whether it's a scratch down to surgery, you will produce collagen. Right. You cannot. It's physically impossible not to.
Yeah.
So, but it depends on the depth you go to determine the collagen deposition, to determine the length of time that it takes to heal. The best one, again, from the general public's perception, I get loads of people coming to me with little lumps on their fingers, which they think is a wart. It's not a wart, it's a hypertrophic scar. And they're like, no, it's not. It's got to be a wart. It looks this like round thing. I'm like, okay, have you cut your finger recently? And they're like, no, I haven't. You're wrong. I'm like, no, I'm talking like a year ago.
Yeah.
And they go, oh yeah, on that cabbage. I went, there you go. It's taken that long for it to heal.
Wow.
So the average Joe, we just think the minute the skin's healed over, it's done. No. It was so much more is happening. So all of that stuff, it can take between 3 weeks and 18 months for collagen production to be finished.
Amazing, isn't it?
So that is incredible. So I mean, again, that cannot not happen. We will not be allowed to have a hole in our body, but the brain will not allow it. And the only way to fill that hole is through collagen. So, you know, we know the treatment is absolutely right and 100% successful. The only difficulty is doing it correctly. Yeah. So that was a bit of a problem for a while, because we were all taught that it was deep, blood, anesthetic, all of these things. And I'm putting myself on the pedestal here too. When it first came out, I did that. And I realized at the time I didn't quite understand it. I didn't really like the idea of it, because you've got these 6 weeks between each one. And so suddenly the treatment would take so long to get the results because of this 6-week gap in between, and the fact that it was quite traumatic for the client. Yeah. And then when I started doing all the research and the writing and the degrees and all that stuff, I realized I was wrong. For all of us were, when we realized it, that rather than working with the specific collagen, that's going to happen anyway. What we're looking for is growth factors. So we have lots of growth factors in our body, and they're responsible for everything. They're amazing, but they only have one job to do, each one of them individually. So when we were initially taught, we were taught to attack the fibroblast growth factor, which is very deep into tissue. So it's about 1 to 1.5 mil. Now the fibroblast, without being really off on one, produces collagen. That's its job, and elastin, the hyaluronic acid. It's amazing, guy. It's very, very clever. But it also gets a bit upset if you mess with it. So if you cause too much trauma to the body, to the skin, the fibroblast will be like, no, not having that. And it will think that it's had a different kind of wound than the one that you're wanting to produce. Yeah. So it produces 16 forms of collagen. We only want 2. Yeah. So if it produces the wrong collagen, suddenly you've got fibrosis, you've got keloids, you've got hypertrophic. Yeah. And that happens from deep needling. So then we suddenly realize, well, hang on a minute, because our body is so clever, and our skin especially, and it is an organ, a living, breathing organ. Yeah. Why are we telling it what to do? Why don't we just ask it nicely? That's how I look at it.
Yeah, it's a good point.
Totally. Suddenly, I changed all the protocols, and the best depth for collagen induction is 0.5, because we have, again, sorry if I'm going off on one, but every cell in the human body has to talk to each other.
Yep.
It cannot. When a cell turns off, we're in trouble.
Yeah.
Things happen. Cells turn off, and I can work out sometimes what's going on. Cells turn off, melagenesis, collagenesis, all sorts of things can happen. And we need to know that these cells are in constant communication, everyone's happy. So if we suddenly target two very, very important growth factors, which sit in the epidermis, and both of their job is, one is cellular communication.
Yep.
So that's my best friend. And the other one is the epidermal thickening. So you talk to those two, you tell them what to do, have a little word with them. They're then going to have a little word with all the others.
Yeah.
And if they feel that you need more collagen, they're going to tell the fibroblasts to act accordingly, rather than us forcing it to.
Yeah.
Basically slapping it around. And so suddenly this 0.5 goes from every 6-week treatments to deep downtime to 2 weeks, 2 weeks, 2 weeks, 2 weeks, 2 weeks, which means you get a much quicker response and result.
Yeah.
You can target much easier. There's literally no downtime or pain whatsoever. And I've been doing it for the last few years, and the results are night and day.
Yeah, amazing.
In comparison to what they used to be back in the 1.5 days. But also, we have other things that people are concerned about. So people are concerned about fine lines and wrinkles. They're concerned about deep glabellar lines here. Stretch marks, scarring, pigment. And every single one of those conditions lay in a different layer in the skin. So you can't just do one depth, rip the skin to shreds and expect it all to work, because it's not going to happen. So you know that if you want stretch marks or scarring and things like that, you've got to go deeper.
Yeah.
Those responses and those growth factors you're looking for are deeper, because you want to produce the collagen that's going to help with stress. Because things like scarring, you have to break down the scar to rebuild it.
Yeah.
Whereas with collagen, we're just starting that lovely little response.
Yeah.
And as Jane picked up on with products and things, I mean, I was never really a massive advocate for implantation of product. And the two things sit separately. And as Jane knows, I'm obsessed with mesotherapy, which is my number one in life, because it's just nutrition and health and everything that sits inside it. But they are two very separate entities.
Yeah.
So needling, you're creating a wound to kickstart collagenesis. Mesotherapy, you're implanting all of the incredible vitamins and minerals and amino acids that will actually go forward to remove the pigmentation, rosacea, acne, collagen. All of it is happening. Now, if you implant mesotherapy cocktails with needling too deep, you can actually interrupt the wound healing response.
Yeah, right.
And you really don't want to do that, because it's very complicated. So for me, if I'm doing implantation of product for, say, pigmentation, like more whitening or rosacea, then it's very superficial. All we're doing is just breaking the surface of the skin to allow the product in. Yeah,
you're going just under the pigment.
Yeah.
And then it just breaks it down from the inside out. Yeah.
Definitely. And then you get phenomenal results. But people are still doing like 1 mil, banging all this product in, and the body's just going, what are you doing? This is just too much for me to cope with. Because, I say to patients all the time, you all want instant gratification. We're still there right now. And there's only there's only one thing that'll give you instant gratification, and that's filler. But that's not permanent. Botox doesn't make you look younger. It just gives you like a bit of a glow, and done wrong. But that only lasts for 6 months to a year as well. So neither one of those things, so much I love them, have a permanency. We want to. So I say to them, like, okay, if you had a problem with your heart or your liver or your lungs, you'd go to that consultant and say it was your heart, and that consultant said to you, okay, no, we're all right, but what you need to go on this certain particular diet, you need to do some exercise, you need to drink water, come back and see me in 6 months and readdress. I said, would you argue with that consultant, and they're like, no, God,
No.
of course I wouldn't. I went, so why are you arguing with me?
Yeah.
The skin's bigger.
Yeah.
It is an organ. And they kind of go, oh my God, you're right.
Yeah.
So this organ is not as complicated as the heart, but it's up there. And it needs to be worked with, and it needs to be held, dealt with kid gloves, really, and not thinking that we're better than it, because we absolutely aren't. And to rejuvenate someone's skin is not a difficult procedure. It's not difficult. You've got to give them time.
Yes, because like you just said, we're getting away from these aggressive treatments, and that goes for peels as well, and we can talk about that another time.
Yeah.
But like you said, the skin is such an incredible organ. It is so clever.
Oh
that
my
you
God,
just it just needs that little gentle, coaxing, and then it's bang, the results are phenomenal. Which also, the concern for me as a professional is when you get these people buying these rollers themselves, and I'm going, well, how deep is it? How do you know that that's the right, don't do it, because like you just said, you're stimulating the wrong type of collagen. You can create
consistently
hypertrophy
traumatizing the skin.
Exactly, because I find that quite scary, actually, that anybody can go online, without mentioning any names, Amazon, and
completely,
buy any roller they like, and I'm like, no, don't do that on your face, or don't,
and
it's
really
quite
deep ones.
I know, exactly, and that is why it's so important that people come and see people like us. But no,
100%, because these things, they're not, it's years of study to do this. That, to be absolutely honest with you, the treatment itself is relatively simple.
Yeah.
The data and education behind it isn't.
No.
Because, like we said, this is an organ, and we are animals at the end of the day. Every last one of us is completely different, and the diagnostics with every single client is completely different.
Yeah.
It's not a one-stop shop for everybody.
No.
But we do hear that. I hear clients all the time. Well, I'm now 45, so I'm going to go onto Amazon and buy my 2 mil needle, and I'm going to do it every day, because that's what someone told me, because Joe down the road's doing it.
Yeah.
I'm like, oh, do it then.
I know.
Because if it's just really, really silly. You've got to listen to your expert practitioner, because they will do it. They can do it. It's 100% proven with both of those treatments, and peels as well. They're the three of them. 3,000 years of history between them.
Yeah, and of course they work really well together, don't they? Because we always start
combination,
the resurfacing before we do the needling process, and obviously a cocktail of amazing ingredients is delivered either on the skin with the puncturing, or like you said, with the mesotherapy, where it's little micro injections under the skin to really give the skin that boost, that vitamin infusion, that hyaluronic, that hydrating,
all the vitamin C's, the vitamin A's, all that
exactly
stuff.
The brightening. No, right, I think that's wonderful.
Did I go off on one?
No. I think you've really explained it, because you've explained it better than perhaps I could. And it's amazing. Like you said, it's great for scarring. It's really good for sun damage, for pigment. Because with the pigmentation, we're breaking things down, and the lines. And I'm all about have a little bit of everything. If you need a bit of tweaking, like you said, a little bit of filler, you might need this, or you might need a little bit of Botox. But at the end of the day, it's about getting the skin to work for itself. And like you said, it's not a quick fix. The skin is an amazing organ. Treat it with care. Put the time and effort in. Use the medical grade products. Listen to the experts that know, we are trained. We're not some dolly day drum down the road that's just bought something off and go, oh, let's just whack this in. We know what we're doing. It is science. So I can't wait to come and do another course with you, Andrew. It needs to happen.
Yeah, let's do it.
It needs to happen.
Yeah, definitely, with that question.
We'll do it. And I said, I'd like to maybe do another interview sometime about filler,
Yeah, absolutely.
Some of the things like that. Cool.
Well, again, you're absolutely right with the combination thing. People can, as I said, filler and Botox were amazing. Yeah. But if you can restructure the skin and get the skin quality back, because that's really what we're looking for, and getting that organ at peak fitness, it means the filler's going to last longer, the toxin's going to last longer, and also you need less of it.
That's what I always say to people, and especially with what we've been going through, you know, where we've all been shut down, we haven't been able to go in and have our treatments. That's what I said. If you're treating your skin better, all those other things are going to last longer.
Yeah, 100%.
Yeah, yeah. And obviously skin comes down to diet and stress and all those other things. But like you said, give it a boost.
Definitely.
Perfect.
That was amazing.
I'm going to let me just stop recording and then.